welcome to episode 6 of this Conversation Matter podcast. I'm Dr. Susan Protasio, your host, and today we have a very interesting topic. I wonder if you have seen someone walking like in a store and unable to initiate some steps, or have unsteady gait, or have some tremors on the hand, and then you wonder, what does this person has? Or you wonder also that how can you help this person? So today we have two guests that would help us know more about Parkinson's disease and the resources that are available. And this podcast, I would like to bring awareness on Parkinson's disease. So our guest, we have Dr. Rosemary Checker. She is a general neurologist working at Patton State Hospital, and she is also affiliated with different hospitals, including Huntington Memorial Hospital in Pasadena and Arrowhead Regional Medical Center. And we have Sadie McCoy. She is the manager of volunteer engagement at Parkinson's Foundation. So welcome to this episode. So Dr. Checker, can you introduce further yourself to our audience?
I think you did a great introduction, and I want to thank you for being here. And I've been doing this general neurology for 40 years, but please don't judge my age. And it's something that I really appreciate. And if I can help some people, to alleviate their suffering, I'll appreciate your inviting me for that.
Thank you so much. Appreciate your presence too. And Sadie, can you introduce further yourself to our audience?
Yes, thank you again for having me, inviting me.
Yeah.
But I am the manager of volunteer engagement for the Parkinson's Foundation. I am also the granddaughter of a person with Parkinson's, so it's a cause that's very near and dear to my heart. And I'm just so excited to be here. I love my job, getting to support volunteers, so excited to hopefully bring a few more on.
I know. And I would like to share some data, because Parkinson's disease is one of the fastest growing neurological disease. And the 2022 study revealed that nearly 90,000 people in the US is diagnosed with Parkinson's disease each year. And then 1 million people in the US live with the Parkinson's disease. Globally, there are over 10 million people that are living with Parkinson's disease. And it is reported to rise to 25 million people 25 years from today. So that would be in 2050. So Dr. Checker, what is Parkinson's disease, and why do you think we need to bring awareness to it?
Parkinson's disease is an age-related pathology starting above 60 years old, and includes motor and no-motor symptoms. And that's what we call now a complex disease, because it has so many nuances, so many parts of the body is affected by Parkinson's disease, that becomes overwhelming. And for the patients, for the caretakers, even for us, the physicians.
Yes.
So it is a degenerative disease from certain parts of the brain. The neurons responsible for the dopamine that we need badly for our motor function, the cells die.
Right.
And we kind of have an idea what is causing that. It's we call alpha-synuclein protein that goes in the cells, conglomerate, and die that specific cell. But why that happens?
Right.
That is still, we don't know.
Right.
Those are major studies, yes, it's beautiful, maybe help with treatment, but we don't really know what is the cause.
Yes.
And so it has a kind of a prevalence for a male, a little bit. And as you said, the statistics I was reading in 2016, we had 6 million globally, not in the United States. And in 2021, you went to 11 million, and they project 2025 to be about double of it.
Right.
It's growing. Is it because the elderly population is growing? I
We
don't
don't
know,
know.
is a factor.
Right.
In other words, there's a lot that we
Yeah.
don't know about Parkinson's
Yeah.
disease.
And then if you read some research online, they would say the cause are genetic, a combination of genetic and environment. Genetic in the sense that the study says that I think around 10 to 15 of those Parkinson's have some mutations on the genes, but they're not really sure that it causes the Parkinson. Yeah.
The majority of Parkinson is idiopathic. And there is 5 to 10% that is genetic. Those are the ones that start before 60 years old. They are young people. So that's why if you are young people, meaning below 50 years old, and and you have Parkinson's, or you have a family history of Parkinson's disease, you should have a genetic test done. Those are
Okay.
done. But it's what?
Yeah,
No more
yeah.
than 10% of the Parkinson's disease in general.
Yeah, because they say,
majority.
because they categorize it as like early Parkinson's disease. If it is below 50, it happens below 50, and late Parkinson's disease onset, late onset, if it is after 50, right? But normally, I think it starts at like around 60 years old.
Yeah, above
Yeah,
60 years
yeah.
old, I think is the more common.
But the good thing with bringing awareness is the early diagnosis. Bringing awareness to Parkinson's, there could be an early diagnosis, although sometimes it's hard also to make a diagnosis initially because the symptoms that they have are seen also in other diseases, like like the non-motor symptoms, constipation or feeling tired. You see it in other diseases.
Yeah.
So, what are the most common symptoms that the patients with Parkinson's
They
shows?
have the prodromes,
Okay.
prodrome period of the
Okay.
disease. That it can happen 10 years before they have one of the triad for the real signs of Parkinson's disease. Now, those prodrome symptoms, the truth is, they are very non-specific.
Right.
They can happen in people with
Right.
other conditions that cause Parkinsonism, which is something we have to do the differential.
Right.
So those prodromes, one thing very important, and they are giving a lot of emphasis, is the RAIN, sleep behavior disorder. Those are people that very early start to have this parasomnia problems, where they start to having these dreams and they act out, and nobody, okay, it's just a sleep disorder. They don't know that later on maybe this is already a sign,
Right,
but
right.
it's, as you said, it's very non-specific.
Right. Right.
But we look up for those symptoms. Also, neurocognitive impairment.
Okay.
The person is not the same, has some mild memory problem, not dementia, but
Yeah.
have difficult to execute
yeah.
higher functions, or they have depression or anxiety. And one important thing, they lose the sense of smell.
Yeah. Yeah.
And that comes way before the
Way-
diagnosis of Parkinson's
okay.
disease. Those are prodrome
Right.
symptoms.
Yeah, and I read also that there's the loss, 60 to 80% of the neurons are lost already before the initial symptoms come.
Definitely.
Yeah, and then for the motor symptoms, because there's a decreased dopamine, which is the neurotransmitter that caused our muscles to move, and there's none of it, so they would have stiffness also, like the stiff movement. They could have some tremors of the hand.
Yeah, those are the triad,
Right,
From
right, yeah.
Parkinson's
And,
disease.
yeah,
The tremor, the bradykinesia, and the rigidity.
Right, right.
And then the characteristic for Parkinson's is, in general, it starts in one side.
Yeah. Yeah.
So the shakes start in one side
Right.
and later progress to other side. They are more rigid on that side. They have more slowness on that
one
side
side.
of the body.
Yeah. Yeah.
And then the tremor is the characteristic pure rolling tremor,
Right.
right? Mostly seen when they are resting.
right,
Their
yeah.
hands are here and they are resting. Or when they walk,
Yeah.
then you can kind of exacerbate it
Yeah.
a little. It's easier
Yes.
for us to see.
Yeah.
And the body can, and actually, even though people get very upset with that, it's from all the symptoms is the least cause of disability. Bradykinesia,
Bradykinesia.
the slowness
Yeah.
that they feel, that is a major disability problems where
Right.
they start to be slow in doing all their activities of daily living, you know,
Yeah.
and they start to have a masked face, right, the poker
Yeah.
face, and they start to have problems swallowing,
Yeah.
or they lose the dexterity. They
Right.
cannot button their clothes.
Right,
They
right.
cannot play the instruments. They cannot click the mouse twice.
Right, that's true. I have an experience with an individual. He has Parkinson's for 18 years now. And I asked him, what was your first symptoms? And he said he noticed that there's a weakness of the right hand, and he do a lot of work with his tools, and he noticed he's not able to really grasp the tool, and he cannot tighten the screw anymore like before.
And the
Yeah.
interesting is that they don't know how to explain to you.
Right.
And now that you said that, they come to you and say, I don't know, I am weak.
Right.
Or I'm tired. Those are the signs of bradykinesia for
Right.
patients.
But then because they don't have the full symptoms, so when they come, it's attributed to probably other medical conditions. So how do we diagnose Parkinson's?
Clinical is still the best diagnosis
Diagnosis.
for Parkinson's disease, no
Not-
doubt.
Yeah.
Is look in the triad, you know. And but before I get there, I want to say something about some disabling problem
Okay.
for Parkinson's.
Okay.
Is the postural instability.
Yes.
They lose the reflex, the postural reflex, centrally because of all the destruction of the neurons.
Right.
So they are so prone to falls.
Yes.
You know, something easy for us, not
They
for
would
me
fall,
anymore.
yeah.
That, you know, a little trip,
You know,
then your reflex,
Yeah.
postural, also you go back. They don't have that anymore.
that is true. That is
and they
true.
fall so easily, and is one of the most disabling
The part.
problems, the bradykinesia and the postural
yeah.
instability.
I agree with that, because this individual
That's
that I'm
what you're
saying that has the Parkinson's for 18 years, he was putting gas. And so thank goodness he was able to put back the pump, and then he just turned and he fell on the ground.
Oh my God.
And then one time he was, I think, going to the bank, he lost his balance and he hit his head on the wall, so they have to call the 911. And then I was reading, the reason for that is in Parkinson's disease, the neurons for the norepinephrine, I think, is also destroyed, the nerve endings, so you don't have that control over the balance. So it's really,
Yeah, and we have a lot of
Yeah.
dysautonomia, right?
Yeah.
In Parkinson's
Yeah.
disease. So then you also have the orthostatic hypotension.
Right,
So
yeah.
you're sitting in the car, you get off to put the gas, and boom, you fall.
yeah.
Because the
with-
blood pressure drops.
without any warning. So
Yes.
it's hard. So Sadie, as a manager of the volunteer engagement at Parkinson's Foundation, how do you bring awareness on Parkinson's disease?
Yeah, so my job as the manager of volunteer engagement, I'm dealing with volunteers who are coming
Okay.
in who want to support people with Parkinson's, help make their lives better. And while the Parkinson's Foundation would love to be in every single community
Yeah.
giving education and sharing that information and those resources, we can't do that. So we really rely on our network of volunteers to help us to reach the communities that we can't, just because of numbers.
Right.
And so I get to help get our volunteers trained up, find the volunteer opportunities that are going to be the best fit for them,
Right.
and send them out so that they can help us spread those resources and those materials
Yeah.
in their communities.
That's good. And that's how I met her.
Yes.
I'm a Parkinson's Foundation ambassador, so I saw it online and I
Yes.
click it, and it says I could apply, and I did, and she did the training for us.
Yes.
So here we are.
So here we are. I'm
Here
so
we are.
glad that we were able to make that connection.
I know.
And that you're an ambassador now.
Yeah, and so we are spreading awareness on
I
Parkinson's.
think I want the title too.
We could sign you
I'll
up.
sign you up.
We can sign you up.
Fine.
So, so what are the national programs that Parkinson's Foundation has?
Oh my goodness, there are so many,
Yes,
too many
Wendy.
to name.
Yeah.
But we definitely focus on, we have 3 pillars at the Parkinson's Foundation. We have research, care, and education.
Okay.
So everything that we're doing is tying back into that. And we are working on a national level to have resources available. You can call our helpline, 1-800-4PD-INFO. It is manned by information specialists for Parkinson's disease. They are amazing. If they don't know the answer to your question, they will look it up and find it for you.
Yes.
And they are there to support healthcare providers. They are there to support care
interesting.
partners,
That's nice.
family members, people with Parkinson's, anybody that has a question about PD, you can call our helpline and they will find you an answer. They are amazing. We also have our website, parkinson.org, super easy to remember,
Yeah.
and there are so many resources that are available there on the national level throughout all 18 of our chapters, resources that you can find in your community as well as virtual resources that you can access at any time.
Yeah.
For patients and professionals.
For
huh?
patients
Yeah.
and professionals,
That's
yes.
good.
Yeah, I checked that website, the parkinsonsfoundation.org. There's a lot of information in there.
There
A
is
lot.
so much
Yeah.
information.
I wonder, is the helpline open, accessible to people from outside the U.S. or just within the U.S.?
That is a very good question. I believe you are able to call. There is also the option to email. It's just
Oh,
helpline@parkinson.org. So if you
The-
do try to call the helpline and you can't get through internationally, you can always
give-
send them an email and they can give you some information
That's
as well.
nice. So that helps a lot of people. You know, it's accessible to them.
Yes.
Okay. So, Dr. Checker, what is the treatment option for patients diagnosed with Parkinson's disease?
The best treatment is still levodopa.
Yes.
You know, levodopa was discovered in 1950s, I believe. Even though the disease by James Parkinson was
Yeah.
cited for the first time in 1817, took until 1950 they discovered the levodopa, and it's still the best
yeah.
treatment. As any medication, it has their side effects.
Right.
Right, and we also have the dopamine aminergics that cause a lot of hallucinations or problems with the patients, but sometimes it just help. But so there's other medications. But I am really now excited is about the stem cells. Sorry if I jumped too much.
That's okay. Yeah, we could discuss stem cells. Why not? You know, it's an
Yeah,
option.
there's not much to it.
Yeah.
It's just, I think that because it's all research, it's
Right.
still experimental, and but it seems that because now you don't hear from the embryonic cell, you can get from the own patient, teach the patient cell to produce dopamine.
Yes.
So this is regenerative medicine, right? So
Yeah.
there, you don't need any more medication because the dopamine is there. So I mean, it's for now,
Yeah.
probably not.
Hopefully, you know, because with the levodopa, carbidopa, I've seen patients that they're okay with the initial dosing, and then as months or years go by, the effect kind of shortens. Let's say it will take it and it
Yeah.
lasts, let's say, before like 6 hours, then as down the road, it becomes like just working for 4 hours.
It's the off period, right?
Yeah, that's the off period. So the off
But
period gets
there
longer.
is something good now. There is it was approved, I think, last year. It is carbidopa, levodopa, but it's called, Parkison. Sorry, if I don't know.
It's okay.
It is, I think it's Crexont. It's Crexoent.
Okay.
And it comes with a new way of delivery, adheres to your wall in the intestine, and then releases it, because the previous one, the dopamine was released in the stomach.
Right.
So it was not absorbed very well.
Right.
Now this one, it's a very, just approved by the FDA, I think last year.
Oh, that's
So
good.
it's
So
very
hopefully, yeah.
promising too.
Yeah.
It's carbidopa, levodopa. It's the same medication. It
Yeah.
is still one of the best
Yeah.
for Parkinson's
So
disease.
hopefully it will work really good, because this individual that I'm referring to, he has bumped up his doses, because
Yeah.
before it's good for 6 hours, now it's good for 4 hours, now it's good for 3 hours. So he opted for other medications, but then there's so many side effects, and then his blood pressure tend to go down, you know, so.
Yeah, they have the continuous pump infusion
Yeah.
too,
Yeah.
which I think it's going to help
Yeah.
a lot. And they have the kind of new deep brain stimulator,
Yeah.
which is to me amazing, but I don't have too much experience,
Yeah,
but
I heard that too.
because now it's not the old deep brain stimulator, it's a newer one, where as the cells change inside your brain, and now you need more this, and now you need more that, the stimulus from the stimulator change accordingly to what the patient needed at that moment.
Oh, okay.
So it's kind of a personalized therapy,
Right.
but it's a surgery.
Yeah. Yeah.
Right?
So
It's not like the
Yeah.
subcutaneous pump infusion.
some patients
They
may
need a lot for dystonia and for the off
Yeah.
symptoms.
some patients probably might opt or choose for it. Others probably would just go with the medications. Now, with patients with Parkinson's disease, do they experience changes in their cognitive function?
Oh, they do,
Yeah.
especially late in the disease. They have.
Yeah.
It's not 100%, not all of them, but yes, and they experiment some mild cognitive impairment. Sometimes they are not capable of doing their functions that they used to do easily.
Yeah.
Some calculations, or
Yeah.
some people do their IRS thing, right?
Yeah.
And then they get confused, but they do. And it depends on the patient's age and how long they have the disease, they can develop dementia.
Yeah. And then I've seen like
And they
this
can develop psychosis too,
Right,
and
right.
bad hallucinations.
going to that hallucination. I'm glad you mentioned it, because this individual that I'm interacting with, he has experienced hallucination like years ago. And it started as a visual hallucination. So he came to his apartment, he said he opened the door, and when he got in, he saw like lions, snakes, and different animals inside the house. And he was so terrified, he has to call his friend. And so the friend came in, and the friend said, "There's nothing inside your house." But he was so terrified because in his mind it was true. So he slept on his friend's house, and then the hallucination got worse. So now he went back to the neurologist. The neurologist gave him some medication. It wasn't controlled. So now they opted to see a psychiatrist to adjust medications. And then they did a review of medications. And I want to say it and emphasize it, that if your patient or your relative are having some symptoms, have their medications checked and reviewed, because this individual, when they look at his medications, some of those are causing hallucination too.
Exactly.
So he's getting hallucination as complication from Parkinson, then he's getting hallucination
From the
also
medication.
from the medication. So they have to adjust all the doses of his
Yes.
medication.
It is interesting
Yeah.
because like dopamine aminergics,
Yeah.
Yeah.
they are so well known to cause hallucinations. So you give, and the patient have a hallucination. But there is a good side. If the patient, if he's the patient, see, there's a major difference between Parkinson if they are cognitively well or not.
Right.
So if the patient is cognitively well and have hallucinations, and because I had cases like this, was including one, the patient, the dog was in his window, actually the neighbor's window, and he would come and see the dog, call the wife. I said, "There's no dog," and he continued and
Yeah.
continued. And so, but he never wanted to change meds because he had no tremor, he was acting very well from the other part.
Okay.
So he said, "No, I don't want it, I don't want it." I said, "Well, you understand that they are not there." He said, "As long as I know they are not real, I am okay. I prefer to have hallucinations than not be able to walk." So
Okay. So, Sadie, what are the programs or other, resources that Parkinson's Foundation has that helps with, awareness of Parkinson's?
Yeah, so some of the things that I already mentioned, the website and the helpline are great. We do also have educational programs throughout the communities that we do. We have our fundraising events like Moving Day, because movement is actually, at least from what I
Yeah.
know, I'm not a doctor, but movement and exercise can be a great therapy, a
Right,
great
right.
No doubt.
medicine in itself for
No doubt.
Parkinson's
Yeah.
disease. So we really focus on that through our fundraising events and
Oh, that's
things,
good.
our
Yeah.
resources that we
Yeah.
have. But really going to our website is going to be the best way to
Yeah,
find all those resources that are
activities. Yeah.
important and those activities that are coming up as well.
Yeah. So if there is someone listening to us or watching us and they wanted to be like a Parkinson's ambassador or to volunteer, how do they do it?
Yeah, so if you want to get involved, you can go to parkinson.org/volunteer, and there's an awesome video where you can hear about volunteering from some of our volunteers. And if you scroll down a little bit on the page, you can find our volunteer interest form, and that actually connects them directly to me, which I think is how we got to meet. Connects you to me so that I can talk with you about your volunteer interests, whether
Yeah.
becoming an ambassador is the right choice for you
Yeah.
or not, and then I can take you through the rest of the training so that you
Yeah.
can go out and spread awareness in your community.
Yeah. And there are many options for volunteering, not just like this one. If you want research, if you want other like, attending events and doing the moving events, you have many options. So I hope you
Yes.
would volunteer as Parkinson's Foundation ambassador. So we have a very interesting topic today and very engaging. So before we end our conversation, is there anything else that you want to share to our audience, Dr. Checker?
Oh, me first.
Yeah, you first.
It's okay.
Well, Parkinson's disease, although it's a progressive disease, it's not a fatal disease. It's not going to kill you. But if you have too many complications, this will decrease your lifespan for about at least 2 years.
Okay.
So that's one thing. And we have a lot of not
Resources.
medication, but treatments
Yeah.
nowadays.
Yes.
And is really in a beautiful progress stage right now. We think it's a lot of hope
Okay.
for those patients. And so don't be afraid. And I ask the patients, be patient with your doctors
Yeah.
because to manage the medication is not easy.
Right.
It's not easy. So
Yeah.
be a little patient with your doctor. Don't give up. Keep going and complain about all your symptoms.
Yes.
One thing that I want to emphasize here is like when they do the doctors, they have urinary issues. They also have some things that they don't like to talk about. Is the sexuality
Yes.
that can be under or can be hyper.
Right.
And I think it's some things that if the doctors don't ask you, don't feel ashamed to touch
inform,
at that
yeah.
point.
Yeah.
So they can have a if the patient has Parkinson's, has a normal cognitive, they'll have a practically normal, near normal life.
Yeah.
And the last thing is physical therapy.
Yes.
They have physical therapy just directed for Parkinson's, just for people so that with the specific needs, especially the equilibrium,
Yeah.
because they need a lot of balance
Right.
training.
Right.
And the caregivers that we thank you a lot
I know.
because
I
it's
know.
not easy.
It's not easy.
And if the more you know, the more you will be able to help the
Right.
patients. Be compassionate.
Yeah.
And just, if you are a caregiver, you're probably already compassionate. But with
Yeah.
Parkinson's fluctuate.
Yeah.
That's the
yeah.
problem.
You need more.
And a good diet. Not too much protein during the day because it interferes with the level of dopamine. Eat your proteins at night, a little less at breakfast, a little less at lunch.
Okay. Thank you. That was very informative. And how about you, Sadie? Anything you want to share or impart before we end the conversation?
Yeah, just something that I've learned in working with the Parkinson's community is that Parkinson's disease is different for everyone.
Right.
Every person is like a snowflake.
It is.
Every version of Parkinson's is going to be different, but you are not alone. There are so many
Right.
people out there that are also dealing with the disease. There are so many
Yes.
amazing care partners and doctors that are
Yes.
trying to make a difference. We have so many resources available to make it easier if you have a planned hospital stay or if you're newly diagnosed. Unfortunately, there's a lot of people that are diagnosed that are told, you have Parkinson's, bye, we'll see you
Yeah.
in 6 months. And so we have
Yeah.
we have guides for people who are newly diagnosed so that they have that
That's nice.
information and they can find the information when they need it, because
Yeah.
it can be scary. You don't always want to know exactly what's going to
Right,
happen down the
right,
road,
correct.
but we have the ability to
correct.
look at that
Yeah.
information when you need it, learn what you can. Just don't be afraid to ask, and the Parkinson's Foundation is here
Yeah.
to support you and help make life better. Oh, I should do a real quick plug. We talked about genetics and how that can be a part of Parkinson's, and the Parkinson's Foundation actually has a really awesome genetic study that they're doing called PD generation, where people with Parkinson's can get tested genetically
Right.
for free, no cost,
Yeah.
and they actually get to have a counseling session with a genetic counselor so that they have an
Really? Yeah.
understanding
That's pretty good.
of
Yes.
how their genetics affects them and their family, and it could be some really great information.
Yeah.
So
Very
we've
good.
tested over
That's nice.
22,000 people
Wow.
with Parkinson's already.
Yeah.
And so if you do have Parkinson's or you know someone who has Parkinson's, you can get involved with that. Parkinson.org/PD generation.
Yeah, and the counseling is free.
Yes, counseling is free. It's
Testing
all free.
and counseling are free, right?
Yes.
So that's
That is
awesome.
very interesting.
Yeah,
Very
yeah, it
interesting.
is.
Good.
Yeah, and so I would like to add also that to have an effective care for an individual with a Parkinson's disease, it requires a multi-specialty team
Yes.
effort.
Correct.
There has to be like a
Correct.
team of health professionals that include the neurologist, the nurse with the Parkinson's specialty, your physiotherapist, your occupational therapist, and
My
also your
The speech
therapist.
therapist for dysphagia.
Right. And if the hallucination is getting worse, you might also need probably an involvement of the psychiatrist.
Yes.
And,
And
for
your care partner. Your care
Yeah.
partner is part of your team.
yeah,
Oh,
the care partners,
definitely.
yeah.
They are
Really
very
are.
important.
And then the caregivers, I salute you because there's so much, effort because of, fluctuation in the moods and all these symptoms.
Yeah.
So I salute you. And that is the main reason why I wanted to bring awareness to Parkinson's disease. And initially, I know that the Parkinson's disease is a very complex topic, and we cannot cover everything in this very short time of conversation. So if you want more information, consult your physician or probably go to the website of the Parkinson's Foundation. It's very informative. And so when I created the title of this episode, my title was Parkinson's Disease, Do You Know Me? Have You Seen Me? So hopefully after watching us and listening to us now, you could say, Parkinson's disease, I know you, I see you. So thank you so much for watching, and I'll see you in the next episode. And don't forget to click the subscribe button, okay? So take care of yourselves and blessings.